Gentlemen, today we're going to address a subject that many of us, especially after turning 60, tend to avoid talking about openly: masturbation. Now, I know some of you might feel a bit hesitant, but let me assure you, it's a completely natural and healthy part of human sexuality. And for men in their later years, it's not just about pleasure, it's an important factor for both physical and emotional well-being. But here's what I've observed over years of practice. After 60, certain habits and techniques, even ones that once worked perfectly, can actually lead to discomfort or even potential health issues down the road. Today, I want to share exactly how to masturbate safely after 60. More importantly, we're going to go over the 3 major mistakes I see men making over and over again, mistakes you absolutely need to avoid. This isn't just about pleasure, gentlemen. It's about your prostate comfort, your long-term sexual health, and making sure you maintain a fulfilling sexual life well into your later years. If you stick with me, I'll guide you through safe, effective techniques that protect your most sensitive tissues while still allowing you to enjoy yourself fully. A quick note before we start. This video is for educational purposes only and is not a substitute for personalized medical advice. Always consult your doctor about your individual health needs. Over the years, one thing has become very clear to me as a urologist. Addressing all aspects of men's health, even the most personal and private ones, is absolutely essential. Masturbation is a completely normal human behavior that doesn't stop being relevant as we age. For older men, regular sexual activity, including solo activity, can have real benefits. Studies suggest that regular ejaculation may support pelvic comfort and proper fluid turnover in the prostate. While the evidence on preventing prostate disease is mixed, one thing is clear: it's an excellent way to relieve stress and maintain mental well-being. But here's where the nuance comes in. Our bodies do change as we age. Tissue elasticity decreases, natural lubrication can decline, and sensations may shift. Techniques that once felt great might now create discomfort or even injury. So while the act itself remains healthy and beneficial, how you do it becomes crucial for long-term comfort and overall health. That's exactly why we're going to focus on the specific mistakes I see most often and how to correct them. Let's dive into mistake number 1. This is by far the most common oversight, especially for men over 60: not using enough or even the right kind of lubrication. As we get older, natural lubrication can diminish significantly. Engaging in friction without proper glide doesn't just create temporary discomfort, it can increase the risk of micro-injuries to delicate penile tissue. Over time, these micro-injuries have even been linked to conditions such as Peyronie's disease, which can result in painful curvature. The solution here is simple but effective. Make a habit of using a high-quality lubricant. Water-based lubricants are easy to clean and safe for most situations. Silicone-based options last longer and are ideal for drier skin or longer sessions. Just remember, they're not compatible with silicone toys. And a critical note: oil-based lubricants should never be used with latex condoms because they degrade the material. Apply generously and don't hesitate to reapply as needed. Think of it as protecting one of your most sensitive areas. Moving on, let's talk about mistake number 2, and this one often goes hand in hand with the first. Many men, especially those of us over 60, rely on the habits we developed when we were younger, applying more pressure, thinking it leads to more sensation. But after 60, that approach can actually backfire. Overly aggressive techniques, too much squeezing, or bending can put stress on the delicate erectile tissues, the tiny blood vessels, and crucial nerves. This isn't just theoretical. It can lead to bruising, lingering numbness, or even long-term damage. Ironically, applying more force often reduces the very sensation you're trying to enhance. So, what's the safe alternative? Focus on gentle, rhythmic motions. Take time to explore techniques that prioritize comfort and pleasure over raw intensity. Slow, steady, mindful strokes allow sensation to unfold naturally. It's not about forcing the experience, it's about feeling it. And always, always listen to your body. If something hurts or feels off, stop immediately. Gentle exploration is key, especially as tissues change with age. This mindful approach protects your physical health while still letting you enjoy the experience fully. Now, let's move to mistake number 3, a step many men overlook entirely, but it's crucial. Neglecting proper hygiene immediately after ejaculation can create significant problems. While it might seem minor, It's essential for preventing infections, particularly in men with underlying conditions like an enlarged prostate or diabetes, which increase susceptibility. Residual fluids left on the skin can become a breeding ground for bacteria, leading to urinary tract infections, irritation, or lingering discomfort. The solution here is simple but highly effective. After ejaculation, always wash your penis and the surrounding area with warm water. If you prefer, use a pH-balanced, fragrance-free cleanser designed for sensitive skin. Avoid harsh soaps. Thoroughly dry the area. This simple practice maintains skin health, significantly reduces infection risk, and supports overall comfort. Think of it as basic, essential self-care that protects your long-term sexual health. So why is it so important to be mindful about these practices after 60? It's not just about avoiding immediate pain, though that alone is worth the attention. Being careful helps preserve your long-term sexual function and comfort. By treating your body, especially sensitive tissues, with care, you actively support better blood flow, healthier nerve function, and reduce the risk of injury or infection. This is an investment in your well-being that pays off in how you feel physically and emotionally. All right, gentlemen, now that we've covered the three main mistakes, let's focus on some key takeaways that are essential for maintaining comfort, health, and pleasure after 60. First and foremost, listen to your body. Any pain, discomfort, or unusual sensations are your body sending you signals. Don't ignore them. They're not a minor inconvenience. They're feedback telling you something needs adjustment. Responding appropriately can prevent more serious issues down the line. Second, be open to exploring new sensations. As we age, what once felt pleasurable may shift. Tissues change, sensitivity can decrease, and habits from younger years may no longer be optimal. This is completely normal. Embrace a mindset of curiosity. Experiment with gentle pressure, different techniques, and varying rhythms. Focus on what actually feels good now, not what used to feel good decades ago. This awareness helps maintain not only physical comfort, but emotional satisfaction too. Third, remember that frequency is personal. There's no one-size-fits-all answer. Some men may find a routine of daily or near-daily activity works, while others prefer a few times a week. The key is to stay attuned to your body and what feels healthy and fulfilling for you. Avoid comparing yourself to others or past patterns. This is about your unique health and well-being. Fourth, and critically, hygiene is essential both before and after. Proper cleaning protects you from infections, irritation, and discomfort. Using warm water, gentle, pH-balanced cleansers, and thorough drying may seem simple, but these small habits compound into a huge benefit for your sexual and overall health. Think of it as the foundation upon which all safe sexual activity rests. Now, here's a non-negotiable point I want every man over 60 to understand. While these tips are practical and evidence-based, they are not a substitute for professional medical advice. If you experience persistent pain, unusual bleeding or discharge, sudden changes in sensation, difficulty achieving or maintaining an erection, or any other concerning symptoms, you must consult your personal doctor or urologist immediately. Early detection and timely treatment remain your best protection against long-term problems. At the end of the day, masturbation is completely normal and healthy at any age. By understanding these mistakes and adopting safer, mindful habits, you empower yourself to maintain a comfortable, fulfilling, and healthy sexual life well into your later years. This isn't just about pleasure, it's about self-awareness, proactive self-care, and long-term sexual health. Now, gentlemen, let's talk about how to put all of this into practical action. It's one thing to know the mistakes, but it's another to integrate safe, effective practices into your daily routine. First, consider your lubrication strategy. As I mentioned earlier, water-based lubricants are easy, safe, and effective, especially for everyday use. They glide smoothly, reduce friction, and prevent micro tears. If you need longer-lasting moisture, silicone-based lubricants are excellent. Just remember, they aren't compatible with silicone toys. And avoid oil-based lubricants. If you use latex protection, they can degrade the material. Apply generously and don't hesitate to reapply whenever necessary. Think of it as protecting the most sensitive tissues of your body. Next, focus on gentle, mindful technique. This means slow, rhythmic motions that prioritize sensation over force. Avoid excessive pressure or aggressive movements. Your tissues have become more delicate over time, and overexertion can lead to bruising, numbness, or even long-term damage. Take your time. Explore what feels pleasurable now. Feel the sensations as they build naturally rather than trying to rush or force the experience. Gentle exploration is not only safer, but often more fulfilling emotionally and physically. Another practical step is hygiene after ejaculation. Wash the penis and surrounding area with warm water, and if you prefer, a mild pH-balanced cleanser for sensitive skin. Avoid harsh soaps. Thoroughly dry afterward. This simple act prevents infections, irritation, and discomfort, especially for men with underlying conditions like diabetes or an enlarged prostate. It's small but highly impactful for long-term health. Let's also touch on frequency and scheduling. There's no magic number, but consistency matters. Some men may benefit from regular, routine activity to maintain pelvic comfort and fluid turnover, while others prefer less frequent engagement. The key is personal comfort. Track what feels right for you. The goal isn't just ejaculation, it's maintaining a healthy rhythm that supports both prostate health and emotional well-being. Finally, I want to emphasize the importance of self-awareness. Pay attention to how your body reacts. Any discomfort or unusual sensation is a cue to adjust. Experiment with different lubrication, techniques, or timing. Your experience may change day to day. Respect those changes. This mindset transforms masturbation from a routine habit into a safe, empowering, and health-promoting activity. Gentlemen, as we wrap up, let's take a step back and look at the big picture. Masturbation after 60 isn't just about immediate pleasure, it's about maintaining long-term sexual health, comfort, and confidence. By being mindful of lubrication, technique, and hygiene, you're actively protecting delicate tissues, supporting healthy blood flow, and reducing risks of injury or infection. Every careful, intentional action you take now is an investment in years of fulfilling sexual function and well-being. Remember the 3 core mistakes we covered: insufficient or wrong lubrication, overly aggressive technique, and neglecting hygiene afterward. Avoiding these isn't complicated, it's about awareness and consistency. Use high-quality lubricants, move gently and rhythmically, and clean properly afterward. These small adjustments make a big difference. They preserve sensation, prevent pain, and help you feel confident and in control of your sexual health. I also want you to internalize a broader mindset. Age is not a limitation, it's an opportunity to approach intimacy with wisdom. Bodies change, yes, but understanding those changes allows you to adapt safely and intelligently. You can still enjoy pleasure, maintain prostate comfort, and embrace a fulfilling sexual life well into your later years. The power lies in knowledge, mindfulness, and respect for your body. Finally, let's not forget the importance of professional support. If you experience persistent pain, unusual discharge, changes in sensation, or difficulties with erections, don't ignore it. Consult your personal doctor or urologist. Early evaluation and treatment ensure your health and comfort are preserved. Knowledge plus action equals empowerment. And that's what I want for every man watching today. So, gentlemen, take these lessons, integrate them into your routine, and own your sexual health with confidence. Masturbation is natural, normal, and beneficial, but only when done safely and mindfully. You now have the tools to avoid mistakes, protect your well-being, and maintain a pleasurable, comfortable, and healthy sexual life well into the future. If you found this video helpful, like, comment, and subscribe to Thrive with Dr. Jocelyn for more science-based, practical advice for men over 60. Ask questions in the comments, I may answer them in future videos. Stay informed, stay proactive, and remember, sexual health is self-care, and it's never too late to take charge. I'm Dr. Jocelyn, and I'll see you in the next video where we'll explore low libido after 60, what's normal, what's not, and how to safely reignite your spark. Stay healthy, stay confident, and continue prioritizing your well-being.